A warm greetings to everyone. I am Dr. Manigandan, physician, practicing in Tirumala Mission Hospital and PM Medical Center in Ronipet district. This is a small video to create awareness to people about heart attack on this occasion of World Heart Day. So first of all, what does heart attack really mean? See, for every organ to function, you need some amount of blood supply. That is, the blood has to carry oxygen to that organ. The similar way, the heart also needs blood. That is the oxygen. The blood carries the oxygen to the heart. When the blood vessel to the heart is blocked, then the heart cannot get its oxygen. Then the heart muscle dies, and then this results in heart attack. When the heart muscle dies, it cannot able to function its normal activities. That is, the heart cannot pump the blood supply blood to the various parts of the body. This results in heart attack. So, what are the risk factors? Like, what are the risks or people who are at risk of getting heart attack? The first thing is diabetes mellitus and hypertension are the two commonest diseases which can lead to heart attack. And also, not only this, suppose if the patient has overweight, that is, if BMI is more than 25, or if the patient has any family history of heart disease, that is, his parents or any relatives, first any relatives have a previous history of heart attack, or if the patient has a very high cholesterol, that is dyslipidemia, or if the patient is a lack of exercise, or if the patient is a chronic smoker, or if he has been taking alcohol for a longer time, these are all considered to be the risk factors. That is, these patients should be aware that they can have the risk of heart attack and they should try to modify their risk. So, what is the exact symptom of the heart attack? Usually, as everyone knows, the most commonest symptom of the heart attack is the chest pain. They usually get the chest pain in the left side of the heart, and the type of the pain will be of very tightening or squeezing. Some people say that some very heaviness over the chest, or a very huge weight is kept on the chest. And associated with that, they may have a sweating and palpitation, and the chest pain may radiate to the left shoulder. These are the commonest symptoms, the most common symptom of a heart attack. So many of the people describe this as a gastritis or the chest pain due to gastritis, and they take themselves pre-medications like a pantoprazole or something, and then they stay home and they ultimately land up in a severe full-blown heart attack. And the other symptoms, there may be, for example, in a patient with diabetic, the chest pain may not be, the heart attack may not have a chest pain, but they may have some other symptoms, like we call it as angina equivalents. That is, they may have a palpitation, they may have a fatigue, they may have breathlessness. So these people should think about it, that if they have these other symptoms also, they should come to the physician and get evaluated and ruled out that it is not a heart attack. So what you should do to prevent your heart from having heart attack? The first thing is always do a regular health checkup. That is, check your BMI, check your diabetes, check your blood pressure, check your lipid profile, and make sure that all your lab parameters are under good control. If they are not, consult a physician and they may prescribe you some medications or lifestyle changes which you should follow throughout. And if the physician asks you to review, you should periodically review with the physician and get all your lab parameters, the blood parameters under good control. So, and if you are overweight, you should follow some lifestyle changes which have been advised, especially a diet pattern which they will prescribe you based on your BMI. And also, you have to do regular exercise, at least for a period of around 150 minutes per week, which we usually say 5 days a week, at least not more than 2 days. The gap should not be there in between the days of exercise. And a moderate amount of aerobic exercise, like 30 to 40 minutes per day, which is minimum essential to keep your heart safe. And also, if you have the habit of smoking or chronic alcohol intake, it is better to reduce the smoking or to quit the smoking and to reduce the alcohol completely. So these are all the commonest things which you should follow to save your heart from preventing from heart attack. So on this World Heart Day, I request everyone to keep your heart safe by following these principles. Thank you.